with the Prime Minister. You've done that several times in the past, but once again last month. I want to know if you can share with us whether you spoke on issues of health being priority, healthcare has been prioritized, digital transformation in healthcare that's taken place, and how India can play a role in changing the global healthcare scenario across the world. Any conversations on this between you and Prime Minister Modi?
Well, certainly, health is 2/3 of what our foundation does. And so we're always talking about the latest thing, and how through partnerships in India, we can prove them out. Treatment for anemia, we need to get the cost of that down. There's a breakthrough that instead of a pregnant woman who's very anemic needing 6 infusions, looks like we can go with 1. And then I was talking with Indian partners how we take the cost of that, which is over $30 today, to get that under $10. And so I shared some of those anecdotes with the Prime Minister. The government is putting increasing money into healthcare, and it's maintaining a significant share for the primary healthcare. You've got to spend both at the hospital level and these wellness centers that a little bit, the pandemic, although it was tragic, accelerated the notion of, okay, how many tiers do we have? What services are available? It's been great to see the investment in that, even in the states where the healthcare statistics have been behind. The improvement in Bihar and UP, which have been 2 of our big focus states, are really strong, which the state and federal government have really made that happen. We're pleased that we got to pitch in with it. So yes, it's an exciting time in health, because our understanding of things like malnutrition, finally we're getting some low-cost interventions there that, will make that the human resource, which is the primary resource India has, even more effective.
Mr. Gates, do you really believe that digital public infrastructure that has been made in India is an example to the world, especially amongst developing countries, in providing healthcare effectively to a larger base of citizens? The manner in which COVID vaccinations were given through apps, does that really give a statement of sorts to the world?
Absolutely. The digital approach, you can track, where they're pregnant women, are they coming in for their visits? Are they getting their vaccines? You can make sure that, all the workers are being hired, that they're properly trained. During the pandemic, those digital systems were very impressive. And, now that's being applied to routine healthcare, starting with things like the Potion Tracker, that's coordinating the work of the Anganwadi workers, and eventually all the health workers will get a common view and be able to share data. So that vision that the Prime Minister has enunciated, there's good progress towards that, and in the next several years, we'll really get that implemented. So digital pays off. Even in agriculture, which you wouldn't think, what I saw with the pest control application, that you immediately tell the farmer who's nearby that they need to get there and intervene before the problem becomes significant. The statistics on how that's reduced pest loss, that was the first time I saw that kind of system working well. And, digital applications, the efficiency with which you can give advice to citizens, share information with citizens, get payments to citizens. We always knew that it was a platform that it would get broader and broader, starting with the identity and payment. But now in health, education, and agriculture as the ones that we're helping out with.
Well, during your last visit, I was privy to a conversation that you had at the breakfast hosted by Minister Hardeep Puri. I happened to be there in your honor. And this conversation on artificial intelligence, a kind of conversation that was given, a presentation that was given by Minister Rajiv Chandrasekhar. Do you think artificial intelligence, deep fake, are these areas where India can collaborate with other countries and find the best balance between the positives and the negatives of this technology?
Absolutely. And, it's great that people are already looking into, what is the ability to create, say, a tutor or to provide health advice? And, how can India be an exemplar in terms of taking advantage of this while maintaining the kind of quality that obviously in health and education you want to have? And, the opportunity and challenges are global in nature. The companies doing this work are quite global. For the foundation, we'll have India as a place we want to really help get the pilots done. And so the dialogue about, under what regulatory scheme do you let this go full speed and yet deal with those challenges? India will absolutely be part of that dialogue and bring a lot of expertise to it. As the government embraces these things, their ability to understand what the rules around them should be gets that much stronger.